Us now to talk about that is State Senator Don DeWitt. Thank you so much for joining us this evening, sir.
Hello, Micah and Joe.
First of all, let me ask you this. What exactly are your issues with the Restore Illinois other than the redistricting, or is that mainly the problem?
Well, I think that's part of the problem that we're currently going to have to deal with. I want to say at the onset that we are pleased that the governor has come out with a plan to start thinking about how we revive the economy in the state of Illinois. This 5-step plan is well thought out, but really requires a lot more discussion, hopefully directly with the governor, so we can answer some of the questions that are being asked about why 5 districts instead of 11 that have been in place for almost 25 years. The 11 hospital districts, emergency medical districts, have been in place for quite some time. They are the districts that have been used to measure medical and healthcare capability across the state. I'd like to know, as a suburban lawmaker, for my constituents in my district, why are we all of a sudden being grouped into a new 4-district region combined with one of the largest cities in the nation? We're concerned it's really going to handcuff my district's ability to be able to bring businesses back, save some businesses that may not survive if this business shutdown lasts any longer. We'd really like to have continued discussions with the governor and have some of these questions answered.
You probably heard him say here just a few minutes ago, Senator, that the lines were drawn to make sure, among other things, that there's health care availability, and essentially that connects you to the closest counties around you.
That's true. We have been very fortunate in our district, District 9, which includes Kane County, McHenry County, Western Lake County, and a small portion of Kendall. We have 3 or 4 major hospitals in this district. Our medical district has been in very good shape with regards to infections and with regards to available capability to address medical concerns. My fear is that other areas east of us, particularly DuPage County, Cook County, may not be having such good fortune with regards to their handling of this pandemic. We're fearful that our capabilities are going to be washed over by other areas within this new region. When I asked the question, why was the region combined into 9 counties, the question I got was the administration was concerned about people traveling into the city to work, traveling back and forth between the outlying counties and the core of the city. Mass transit is down almost 95% if you talk to the Pace Bus folks, if you talk to the Metro Rail service people. Most trains you can count the number of people on 2 hands. So I need a better explanation for my constituents who are asking me, why are we being grouped in with such a large metropolitan area?
But Senator, you said that you would like the state legislators to get back to Springfield so you can hash all this out. But a couple of weeks ago, Governor Pritzker said that because you're essential workers, you can go back. Why is no one going back right now?
Well, unfortunately, control of the legislature lays with Speaker Madigan and new Senate President Don Harmon. Those 2 gentlemen have the capability and the authority to call the entire legislature back to Springfield. The governor, in his role with regards to executive privilege as part of this emergency declaration he has made, also has the authority to call this legislature back to Springfield. Look, we've shown, residents of Illinois have shown we can operate safely with masking, with social distancing, in big box operations, putting 200 and 300 people in retail operations that have been deemed essential. I think 177 relatively intelligent people can get to Springfield, act responsibly and safely, and get back to Springfield to start solving all of the problems that we're dealing with in this pandemic crisis.
Other states, Senator, have assigned target dates to their phases. The governor's plan goes strictly with numbers. When we hit X, then we can do Y. Do you fundamentally agree with that?
I agree with the concept, Joe, but my concern is that this governor's plan has a 28-day cycle attached to it. Almost every other state that has started implementing reopening plans is doing it on a 14-day cycle. We're currently in phase 2, which allows some retail businesses to open with curbside service we've opened parks, we've opened golf courses, people can finally get out and recreate. And those are recommendations that we all made to the governor that we're very happy he accepted. But to get into phase 3, which starts to reopen essential manufacturing, starts to open barbershops and salons and other businesses, those decisions can't even be made until May 29th, which is 29 days beyond the last essential order. Restaurants cannot be considered to be open until phase 4, and that point we will not see until June 29th. I mean, we could very well be looking at the middle of summer before bars, restaurants, and other non-essential retail establishments can reopen.
State Senator Don DeWitt, thank you so much for being with us tonight. Be
Thanks
safe,
for
be
your time.
well.